Welcome to this explainer. Today we're tracing a truly fascinating, uninterrupted 5,000-year history. We're looking at the story of cannabis, but strictly through the lens of health, wellness, and validated medical treatments utilized across the globe since the very dawn of recorded history. Let's jump right in.
You know, a lot of people wonder, is medical cannabis really just a 21st century wellness trend? Headlines today treat it like it's this brand new frontier. But honestly, the historical record tells a much deeper, deeply rooted story.
To find its ancient roots of healing, we actually have to look back thousands of years. The historical timeline builds up incredibly fast. Way back in 2900 BCE, the Chinese Emperor Fu Hish referenced Ma, specifically noting its healing properties. Then, around 2700 BCE, the legendary father of Chinese medicine, Shen Nung, discovered its wide-ranging benefits. Fast forward a bit to 1550 BCE, and the ancient Egyptian Ebers papyrus documented specific medical formulas. We even have physical evidence from 1213 BCE. Get this, cannabis pollen was actually found on the mummy of Ramses II, directly linked to ancient treatments for glaucoma. Absolutely wild, right?
It's incredible to see the profound reverence these ancient doctors had for the plant. Shen Nung, the pioneer who reportedly tasted hundreds of herbs, documented it as a cure for over 100 different ailments, including rheumatic pain and gout. He famously described the seeds as sweet and balanced, asserting that eating them over a long period of time might help you become strong and avoid senility.
And this sheer versatility across the ancient world is staggering. Over in ancient Egypt, they were grinding hemp and honey for women's health issues, and even creating suppositories to relieve the severe pain of hemorrhoids. Meanwhile, in ancient Greece, the famous physician Dioscorides documented in his foundational text around 77 CE that juicing green cannabis was excellent for earaches, and boiling its roots, that could drastically reduce joint inflammation.
Moving into India and Islamic medicine. As the plant spread eastward and into the Middle East, its medical applications became even more advanced.
Take India, for example. Around 1000 BCE, Ayurvedic doctors developed a highly effective preparation. They were using a mixture of milk and cannabis, called bhang, as a seriously potent anesthetic. Later texts even cited it as a treatment for devastating conditions like leprosy. Plus, it was heavily utilized as an anti-inflammatory and an anticonvulsant.
Now, rigorous historical documentation from the Islamic Golden Age reveals that Muslim scientists were real pioneers here. Medieval texts detail how the esteemed 10th century Persian physician Al-Razi successfully used cannabis to treat acute epileptic seizures, ear diseases, and even depression. They even figured out how to instill cannabis leaf juice directly into the nostril for rapid absorption during violent seizures. I mean, that is a remarkable precursor to modern acute care.
And we have to talk about the incredibly influential Persian physician Avicenna. His canon of medicine was literally studied in Western medicine well into the 19th century. He explicitly recorded cannabis as an effective treatment for a host of serious issues, like gout, severe edema, infectious wounds, and debilitating headaches. They weren't just guessing. They were selectively utilizing the seeds, leaves, and oils for highly targeted therapies.
So, entering Western medicine. How exactly did we get here?
This ancient knowledge formally reached Western medicine in 1839, thanks to the scientific rigor of an Irish physician named Dr. William Brooke O'Shaughnessy. He didn't just rely on folklore. He actually conducted extensive animal safety tests to evaluate its toxicity before moving on to human trials. Once he proved it was safe, he achieved miraculous recoveries treating terrifying diseases of the era. We're talking infantile convulsions, rheumatism, and the severe muscle spasms caused by tetanus and rabies.
Western doctors completely embraced these findings. By the late 19th century, over 100 scientific papers have been published on the therapeutic value of cannabis. Medical journals were packed with reports, like one from Dymock in 1890 who noted he gave cannabis extract to a large number of hospital patients suffering from chronic rheumatism, stating it entirely relieved the pains. This massive success led to its official inclusion in the 1850 U.S. Pharmacopoeia as a mainstream validated medicine. Pretty soon, cannabis was everywhere in Western health and wellness. You could easily find it in over-the-counter pharmaceuticals. Amazingly, the biggest pharmaceutical companies in the world, names you'd recognize today, like Merck, Parke-Davis, and Eli Lilly, were actually selling tinctures and extracts. It was even highly recommended by Queen Victoria's personal physician to treat her menstrual pain. But then we hit the 20th century decline. A perfect storm of technological and political shifts caused a massive medical dark age for the plant.
You see, before Prohibition even started, medical technology radically shifted. The invention of the hypodermic syringe allowed doctors to use fast-acting injectable opiates, which quickly replaced those slower oral cannabis tinctures. Aspirin was invented as a cheap, mass-produced painkiller, and crucially, life-saving vaccines for diseases like tetanus made previous cannabis treatments for those specific convulsions largely obsolete in modern hospitals. Subsequent legislation really sealed its fate in the medical world. Starting with the Marijuana Tax Act in 1937, it was then removed from the U.S. Pharmacopoeia in 1941, the Boggs Act in 1951 set strict prison terms, and culminating in 1970, it was officially declared a substance with no medicinal use. That completely erased 5,000 years of documented medical history and effectively halted vital clinical research for decades.
Which brings us to the modern medical resurgence. Fortunately, scientists eventually started to return to the empirical data. A massive turning point happened in 1964. That year, Dr. Raphael Mechoulam made a monumental scientific breakthrough. He finally identified and synthesized THC, the main active compound of the plant. Soon after that, the body's own endocannabinoid system was discovered. This was the definitive scientific proof that legitimized those ancient texts, proving once and for all that cannabis has a direct, targeted biochemical effect on the human body. Armed with this foundational science, the modern medical community began a triumphant return to these therapies. In 1996, California legalized medicinal use. Today, major scientific bodies like the National Academies of Sciences, Engineering, and Medicine have rigorously validated its use for chronic pain relief. Furthermore, non-psychoactive compounds like CBD are now officially prescribed for severe, treatment-resistant childhood epilepsies like Dravet and Lennox-Gastaut syndromes.
What's absolutely fascinating here is how perfectly history is rhyming. Current scientific evidence perfectly supports the historical use for pain, headaches, and inflammation. A 10th century Islamic doctor curing seizures using cannabis juice perfectly mirrors today's cutting-edge CBD clinical trials for epileptic children. Modern science isn't really inventing a new medicine, it's systematically proving what ancient doctors already deeply understood.
So, as we wrap up this explainer, remember this isn't just some modern wellness trend. It is a 5,000-year-old, globally validated remedy that has survived empires, dark ages, and outright prohibition. Leaving us with one deeply provocative question, as modern clinical research finally opens up again. After 5 millennia of healing, what will medical cannabis cure next?